thank you to the organizers for creating the symposium and giving us the opportunity to come together and talk about our work and ideas. And thank you, Dr. Schuster, for that excellent introduction to our project. So I'm going to be talking to you about our project, creating an interactive interdisciplinary treatment plan evaluation and simulation tool for teaching this competency. And I am a PGY4 resident at the University of Toronto.
Proceed that way. Just proceed this way. Once the three.
So, as we all know, radiation oncology is an interactive discipline between radiation oncologists, medical physicists, and radiation therapists. And as we've already heard today, treatment plan evaluation is a critical component for delivering safe and effective radiotherapy, and is also a core competency for both radiation oncology and medical physics training programs. As we've also heard today, treatment plan evaluation has been identified as an area for improvement in these training programs. And we also heard some of the challenges related to reviewing plans in a busy clinical environment. So the objective of our project was to create and implement a collaborative interprofessional treatment plan evaluation case bank for radiation oncology and medical physics residents. We started by conducting a needs assessment. So we did a survey of current and former radiation oncology and medical physics residents. We collected quantitative data on their competence in assessing various aspects of treatment plan evaluation using a 10-point Likert scale, 1 being least competent and 10 being most competent. And we also collected qualitative data regarding what resident would like to see in a case bank and how to design the simulation platform. Then we went back through our own institution plans that had been rejected. We categorized them by clinical site, reason for rejection, detectability, and relevance. And then we are going to supplement gaps by generating unacceptable plans, and we're also going to incorporate acceptable plans into the database as well. So you can see we had about 30 respondents, which was almost 70% response rate, and that is the breakdown of the different trainees who responded. And these are some of the aspects they ranked their competence regarding treatment plan evaluation. You can see that some of the more straightforward aspects of treatment plan evaluation, like target coverage and OAR doses, were ranked with more confidence, whereas some of the more complex aspects of treatment plan evaluation, such as overall plan acceptability and ability to suggest improvements to treatment plans, was ranked lower. You'll also notice there is a bit of a spread with the standard deviations, and we have speculated that that's due to the range of training, the level of trainees in the program who completed the survey. So first we started off by going through plans that were rejected from our institution between January 2011 and June 2013, and we identified 530 plans that had been rejected. Once we removed plans that were rejected for pure documentation errors, we were left with 230 plans, and of those, 75 still had the DICOM data associated with them, so those plans were reviewed and categorized. These are some of the categories of the plans that were rejected. So you can see there's conformity, contours, beam energy, arrangement, segments, medical hardware, and some other categories as well. And this is the first iteration of our database. So on the left of your screen there, you can see our graphical user interface, our GUI. And so trainees have the option of either selecting a random case or selecting a specific case, whereby they can choose the clinical site if they want to practice within a specific site, as well as the difficulty level of the case. Then the database will provide them with a case and a little clinical blurb regarding the plan, and then they'll have access to the plan in a DICOM RT platform, where they can scroll through the plan in 3D. They can look at the DVHs, they can look at the beams, they can look at the points of interest, prescription site, and evaluate the plan just like we would in real life. Then they will complete the form. So did they identify an error? what was the classification, how did they identify the error, and then a description of it, and how would they suggest correcting the error. And then once they submit that form, they will gain access to the corrected plan that they will be able to scroll through and compare, as well as an answer key for that specific case. So, in conclusion, we created an interactive interdisciplinary treatment plan evaluation platform for teaching radiation oncology and medical physics residents how to evaluate radiation treatment plans. Our future work, we would like to implement the case bank, assess trainee competence in treatment plan evaluation post-training, assess their satisfaction with the case bank, the perceived effectiveness of the case bank. We've also had interest from our radiation therapy trainees, so we would like to expand the case bank to our radiation therapy trainees and explore opportunities to expand to other institutions nationally and internationally. So I'd just like to acknowledge Jeff Winter is the physics resident who is working on this project with me, and the physicists Tom Purdy and Jim McNiven, and my supervisor Dr. Croak, and funding from the Princess Margaret Seed Grant.